Hi, this is Dr. Murtaza. I am a consultant in pediatric cardiology working with Rainbow Children Heart Institute, Hyderabad. Today, we will be talking about congenital heart disease, or in other words, congenital heart defects. What they actually are, how they present, what is their signs and symptoms, how do we diagnose them, how do we manage them, and how do these children after management, that is treatment, how do they act. Congenital heart diseases are the diseases which are present in our babies since birth, but they can be diagnosed later in age also. And they are very common, like it is in the frequency of out of all 100 babies born, one can be born with a congenital heart disease. So how do these congenital heart defects present? Like what are the signs and symptoms and how can we recognize them? So starting these congenital heart defects can be identified in the intrauterine life before the baby is born. Normally a TIFA scan is done around 18 to 20 weeks of life, in which different parts of the body are scanned and in which heart is also seen. And if there is some anomaly in the heart, they can send us for fetal echo. Fetal echo is a special type of ultrasound in which we specifically see for the heart of the babies. In this, we see the different chambers of the heart, how are they connected, how are they functioning, how are the different walls of the heart working, if there is some obstruction or leakage in the wall, what is the heart rate of the baby, is it very fast, is it very small. So these precise things can be seen in the fetal echo and appropriate management to a limited extent can be provided at that time. Second, now the baby is born. So the babies who are born with congenital heart diseases can present either at the time of birth or they can present later, and it can be as later as in adulthood also. So these babies can present with bluish discoloration of their limbs, oral cavity around the mouth, which we call as cyanosis. They may be not able to keep in weight, or they do not grow in according to their peers. They are not gaining weight appropriately, or they have signs of like rapid breathing is there. We can see some retractions or indrawing of the chest is there below the chest, or there is excessive sweating in these babies. They are not able to gain weight, failure to thrive is there. They are being repeatedly admitted in hospitals for their symptoms. So these can be some of the signs and symptoms in which we need the help of a pediatric cardiologist to suspect a congenital heart disease, and we need to visit them. These babies can later present in their lives with like failure to perform their work activities according to what is expected. They are unable to do exercise properly, they are getting tired easily, easy fatigability is there, or sometimes these babies also present with something known as syncope, in which they get unconscious and all. So how do we diagnose these congenital heart diseases? As we have told that these congenital heart diseases can be like are found from the fetal echo before the baby is born. So the first diagnosis of these congenital heart diseases can be done from the fetal echo. We can easily identify how the rate of the child is, heart rate, if is it very fast, very slow, is it normal, how the different structures are there, how are they working. So the diagnosis starts before the baby is born. After the baby is born, depending on the symptoms, we can diagnose with the help of different modalities, in which chest X-ray, ECG comes first, followed by echocardiography. Echocardiography basically is a special type of ultrasound in which we specifically see the heart of your baby with the help of ultrasound, and different structures and their functions can be found, and a diagnosis of congenital heart disease is made up to 99% of the cases. In a rare few number of cases, like in less than 1% of the cases, need the help of other modalities like CT or MRI or other rarer modalities to diagnose these congenital heart diseases. So how do we manage or treat the patients, the babies who are having congenital heart disease? So first thing which we have to know is that these diseases are treatable, and these babies after treatment they lead a normal life. In up to 98% of cases, these babies are treated and they do not require any second intervention for treatment after they have been once treated. So we have different modalities of treatment for these babies. They can be managed with medically with the help of medicines which we have, which helps the heart to support. There are different modalities like surgical modalities in which surgery can be done to correct these heart defects, in which can be done as a closed heart surgery or an open heart surgery. Third modality is the cath lab interventions, in which we go to the cath lab and the heart defects or any obstructions are dealt with the help of like balloons or devices are there to close these defects, which is done angiographically, in which the admission of the child is just required for a day, and it is like a simple, like not much a complex process. So a common question which comes to our minds is like, okay, my baby has got a treatment for congenital heart disease. How is he going to live after that? How long will he live? What will be his quality of life? Will he be able to go to school? How will be he performing in sports activity? Will he be able to perform social activities like us? As of now, as I told, that 98% of these diseases are treated and they do not require any further intervention. So these children will lead a normal life like other peers. They will be going to school, they will be playing with their peers, they can participate in sports activity and all. With regards to social and interventions and all, they can marry most of these cases except a few cases, as I told, in 2% of the cases, and they can bear the child in the future and they will have a healthy sexual life and reproductive life. Thank you.